Welcome to our session on staff benefits. And after today's session, you will learn how to decide what benefits are right for your childcare business and your staff. During today's conversation, I will go over what are some common benefits, how do you begin to offer benefits, and also what things should you look for when selecting a benefits provider. Many childcare businesses do not provide benefits. Often, cost and affordability are some primary factors. While compensation is likely the number one factor for an employee's choice to enter and stay in a job, benefits are also a critical piece of their decision. Certainly, the cost of employee benefits adds another expense to your balance sheet. However, you must not minimize the invisible cost savings of the value which benefits brings to your business. There are many ways to implement benefits for your staff. When exploring the possibilities for adding benefits to your compensation packages, enter with an open mind and assurance that you can find the right combination within your budget to meet your needs. You may be wondering, why should I offer benefits? So, as a childcare provider, there are many reasons why you should offer benefits, and here are a few of them. Staff feel more satisfied and valued. The pandemic has brought on different needs and considerations for employees, and they need a place of work that can meet those needs. Offering benefits lets your employees know that they're valued and that you support them. And of course, happy and healthy employees are more engaged employees. You'll retain staff more easily. Without benefits, it may be harder to retain or attract staff, especially in today's climate. When these positions are vacant, you may be forced to turn away families seeking care due to lack of ability to serve more children. Further, when there are fewer well-trained employees on staff, the stress of managing more responsibilities can take a toll upon existing staff, causing additional strain. And another reason to offer benefits is that you become more competitive in a tight labor market. When recruiting new staff, benefits can serve as the deciding factor between two job offers with similar wages. Now more than ever, you may be thinking about the culture of your workplace and ways to reward and invest in staff and attract qualified staff to your program. Benefits can be a vessel to do that. While benefits do come with a cost, failing to offer them could also have financial consequences for your business via things like the loss of loyal staff, the inability to attract staff and boost your enrollment, and the impacts of unsatisfied staff. The bottom line is that benefits are important, and childcare providers should aim to incorporate them whenever possible. You should be an informed consumer as you research your options and understand what's available and what questions you should be asking. Providing benefits does not have to be an all or nothing concept. There are different benefits that can be offered with varying price points. Some may be little to no cost, some may be more significant. And even small increases in offerings can make a difference in a tight labor market. You may be wondering where to start and what your options are. Most importantly, you want to be sure that regardless of what you're offering, that your employees can see the value in them, can easily understand the benefits, and easily access the benefits when they need them. Thinking through your benefits that you offer or that you could offer may prompt you to think differently about your business structure and the networks that you participate in to boost your ability to carry certain benefits. So in today's session, we will talk through all of those options. So, what are some common benefits? Depending on your company size and whether individual employees meet certain requirements, there may be some benefits that are legally required of you, such as workers' compensation, Family and Medical Leave Act, also known as FMLA, and even medical insurance. There are other benefits that are not required, but are common amongst employers and are a critical decision-making factor when choosing a place of work. So this is not going to be a complete list, but again, we're going to go through some of the common benefits that a company can offer. So there's paid time off. PTO is one of the most common benefits and widely appreciated amongst staff. This can include holidays, vacation, and sick days. Offering PTO can help businesses remain competitive and attract qualified staff, even when they're unable to pay top wages for the position. Having the opportunity to access PTO can improve staff's overall well-being, which can help reduce stress and burnout, especially in a job as demanding as childcare. There's no hard and fast rule on how many PTO days should be offered, and the amount of time offered can gradually increase with more time on the job. Health insurance. Health insurance is usually one of the first things that comes to mind when someone thinks of the term benefits, and it's highly sought after by employees and job candidates, specifically childcare providers in the climate that we're dealing with recovering from the pandemic. It has brought on a heightened sense of awareness of the health exposures associated with being a childcare educator. So as such, if there is any one benefit worth offering to your employees, health insurance is definitely one to consider. In addition to medical, this benefit can include dental, vision, and prescription coverage. Options within this offering ranges from full insurance to telehealth to only discount programs. Typically, you will find a benefits provider and offer your employees certain benefits from that provider. You could cover a portion of the cost, and the employee would pay a set amount per pay period towards their cost. Alternatively, another option is for you to simply coordinate the health plan coverage for your staff, offering coverage without financially contributing to the employee's elected coverage. Next is retirement. Retirement plans allow employees to build financial savings to help them meet their personal long-term financial goals. While employees who opt in will need to contribute their desired amount of salary per pay period, the benefits that are provided by these plans are: one, individual tax savings for your staff, and two, the ability to receive a set amount or a match to their contribution by their employer. This will help their contributions to grow faster, setting them up for higher earnings during their retirement. Supplemental insurance. Supplemental insurance programs include coverage like short or long-term disability, accidental, and other plans to cover unexpected critical health events. So while this is not your comprehensive traditional health insurance, it can cover certain health events depending on the type of plan that you have. Employee assistance programs are also another example of supplemental insurance, which could give staff access to programs to address mental health and other well-being supports. These are typically more affordable than offering medical insurance. However, it does not replace medical insurance. Tuition assistance and staff development. Staff professional development is an integral part of the childcare business model. Not only are there requirements around staff trainings, but the more knowledge your staff have in child development, the better the experience will be for the children in care. Many staff may be seeking to deepen their knowledge, earn a credential or degree. Investing in staff in this way can support both the growth of your business and your staff, which are the core of any strong childcare program. Many providers find that they can provide these benefits for staff through participating in programs such as Rising Star, Texas Rising Star, or the Teach Texas Scholarship Program. Childcare. Offering discounted childcare to your staff's own children is a great benefit that most childcares may find easy to implement. Oftentimes, childcare teachers and staff have their own children whom they need to find care for. Not only will this benefit give staff peace of mind, but it can also help them to afford the expense of childcare, which is usually a drain on their personal budget. And there's bonuses. The ability to receive bonuses is a benefit that many employees value, especially during these times as staff have had to work harder, longer hours, and under challenging circumstances. There is an opportunity to reward your hardworking employees for this additional effort through temporary pay increases and/or bonuses. And to learn more about structuring these temporary pay increases or bonuses, please visit childcare.texas.gov and select the temporary pay increases and bonuses guide to learn more about how you could offer that benefit to your staff. So you may be wondering next, how do I offer benefits? Where do I start? First, you should understand what benefits you would like to offer based on your organization and employees' needs, goals, and budget. Then think through the types of benefit providers that will help for you to make it a reality. Here are some benefit providers that you may come across in your search. There's private insurance, payroll companies and online services, professional employer organizations, and shared services networks or other platforms for collaboration. And we will talk into each of these in a bit more detail. So private insurance. These are the traditional insurance providers like a Blue Cross, Blue Shield, or Aetna. The most common type is a group plan purchased by the employer that covers employees and possibly their family members. These plans may cost less than an individual seeking their own plan. However, they still could have a price tag that may be too costly for the average childcare provider's budget. You can set how much of the cost you would cover versus what the employee would be responsible for covering. You can buy these plans directly from an insurance provider, a broker, outside of offering company-sponsored health insurance. You can still support your employees on an individual basis in accessing low-cost or free health insurance through the Affordable Care Act marketplace. You can help ensure that employees are aware of what they may qualify for and facilitate a connection for them to work with a free healthcare navigator who can walk them through their options. And to learn more about those affordable healthcare options, please visit www.oppex.org/issue-briefs. So again, offering health insurance can be done in a variety of ways, and sometimes it's just the facilitation of the connection that is meaningful and helpful for a staff person, but also does not cost the employer anything to do so. Or you are able to choose set amounts of the coverage that you will be able to cover for your staff. So there are options. There's your existing payroll company and other online services. So places like Gusto, Paychex, Zenefits, and others. You may be able to purchase group insurance and supplemental plans through your existing payroll provider. They can act as a broker, streamlining the process and help you find plans that fit your needs. So if that is something you're interested in, talk to your payroll provider to see if they offer those services and what the benefits may be of going through them versus a traditional or private insurance. There's professional employer organizations known as PEOs, and they offer a way to outsource HR functions of your business, and they cover things like your payroll. They'll produce employee handbooks, cover benefits, and administer the benefits, and more. PEOs serve as professional employers, however, of their clients' employees. They allow for small businesses to offer benefits that are usually associated with larger companies, as they're able to leverage their large network of employees to offer more affordable rates for insurance and benefits. And there's shared services networks or other platforms for collaboration. So things like Texas Child Care Tools or your local Chamber of Commerce. By participating in these networks, you can receive discounts on certain benefits through companies that partner with the network. So some of these discounts may be on things such as medical, telehealth, dental, and vision insurance. You could also have access to money and time savings services like insurance brokers and enrollment specialists to guide you through the process of setting up a benefits plan. Typically, membership fees to join these networks are low or no cost. So if you're already in a network, you should take a look and see what all they do offer. Or if you're thinking about joining a network, you can just evaluate the cost to join with the discounts that you may be able to access through that platform. So once you have an idea of what benefits you want to offer and through what vehicle, next you will determine what you can afford. Some benefits can be offered at little cost. Remember, there may be invisible costs that offering benefits can help mitigate. Costs associated with things like employee turnover, such as recruiting, interviewing, training, and onboarding, and vacancies in classrooms, can be potentially offset by offering benefits. Talk with a Texas Child Care business coach to understand just how much employee turnover is costing you and to explore planning your budget and cash flow to begin offering benefits. When looking at health insurance offerings are incredibly varied, and the costs are usually based on the number of employees covered, the location of your business, ages of employees and their dependents, and the percentage of health insurance premium that you would like to cover. So we've grouped the options into those that are no or low cost, higher cost, and then what would be the highest cost. So at no or low cost, these are things like arranging group plan insurance for your staff without paying any percentage of the premium. This places 100% of the plan cost upon the employee. A higher cost to you, but of course a lower cost to your staff, would be to cover a portion of the insurance premium for your employees. Typically, this portion begins at 50%. This places the remaining portion of the plan cost upon the employee. and employees can add family members to their plan at their own expense. And at the highest cost are things like you covering the entire portion of the insurance premium for the employee, or covering a portion of the insurance premium plus dependents for your staff person. And just to see exactly what that could look like, we've illustrated here how the costs do depend on location, number of employees, and the percentage of employer contributions to the plan. These figures here do not include dependents, so if you do choose to cover dependents premiums as well, the costs will rise. And the costs can be much greater than those that you see here in the table based on your circumstances and actual plan selections. But as you can see here, if you are located in Austin with a relatively small center of 8 employees, and you want to cover 50% of your staff's premium, the full cost to you would be $1,300 per month to cover your staff. The average monthly cost for your group per employee would be $170 per employee, with your employee covering the other $170. Similarly, if that same center wanted to cover 80% of the employee's portion, that would then cost $2,200 per month, which breaks down into a cost of $275 per employee, with the employee covering $70 themselves. Switching locations, a large center located in Lubbock with 30 employees who wants to cover 50% of the premium for staff, that will come with a cost of $5,000 per month, which breaks down into $170 per staff, with the staff member covering the other half of $170. Alternatively, if this same center wanted to cover 80% of the premium for staff, that would come with a cost of $8,000 per month, which breaks down to $275 per staff, with the staff person covering $70 each pay period for their coverage. Right, so what should I look for? What should you look for when selecting a benefits provider? Once you've thought through the criteria that an employee must meet to be eligible for benefits, you may think next about the costs, how they will be administered, monitored, and tracked within your system. Here are some questions that you should be sure to have answered as you decide on benefits to offer. First question, is this benefit affordable for the long term? What will be the return on my investment? Next question, does it fit the unique needs of my employees? Will they find value in it? If I want to increase staff retention, for example, will this benefit help? Next, what are the total costs, including fees and time, to administer the benefit? And the next question, what are the pros and cons of offering this benefit or selecting this benefit provider? So these are some questions that you should seek to answer as you decide on what benefits to offer, how they will benefit you and also your staff. Many childcare providers view offering staff benefits to improve their operations by boosting morale, decreasing staff turnover, and investing in the longevity of their most important asset, which is their staff. However, providing benefits can also offer financial benefits through tax deductions and time savings. Once you decide to offer benefits, be sure to document your policies and update them as things change. While you're not required to offer certain benefits, you are required to follow benefit policies that you have set forth. We recommend updating your policies and reviewing benefit offerings at least annually. This will help you stay on top of your needs and your employees' needs as they change. For more help on understanding and offering employee benefits, feel free to connect with a business coach or email us at coaching@ecebizcoach.org. Here you can just ask quick questions or request a coach. And you can also visit childcare.texas.gov for links and other helpful resources which are available in English and in Spanish. Thank you.